Hello, my name is Veronica Ackles, and I am going to talk about elder and the end of life care. My professor is Terry Trulin. The due date is June 21st, 2021. The first thing I'll be talking about is ethical issues. Nursing homes tend to talk about patients and not realize that people are standing around such as HIPAA violations. It is a HIPAA violation for staff to stand around and talk about patients because you don't know who's around. The stress levels among the people, among the staff and the families when there is an issue about a person dying. The issues of palliative care. Palliative care is when the patient is dying and they're trying to live out their own wishes or be in a place where the um the staff can accommodate the family as well as the patient, making sure that there is no discrepancies or the home health if they decide they want to die at home. Living and dying at home or versus a nursing home is totally different because all you really want, it's not different, it is the same, but they're in their own environment. That's the difference. And most people would want to die at home instead of dying in the nursing home because they want the peace and the comfort of home. The aging population is changing. Once we've had COVID and other things, there is no set age on dying anymore. The aging goes from at least, well, now is you come in this world to die. But then some people may live to be the age of 70. It just depends on how they live their life. And legalities for the end of life versus being at home and in a nursing home, that the doctor cannot cause death. The doctor has, the patient has to have comfort measures, but that means no heroic efforts. Okay. Providing care at home is that patients are to have around the clock care, especially if they know that they're dying. And there is non-care activities. That means nobody comes in to do anything with them, but just sitting there, even as reading is an activity, or just keeping a perfect person comfortable. Making decisions for the family, which really goes along with hospice, and hospice along with families decide on what is best for the families and what is best for the patient. Managing behaviors, especially if the patient has behaviors, they are hospice can do things that nursing homes or nurses cannot just do. They have to set orders for the patient to have, be as comfortable as possible. And if a patient has a wish that they want done, then that's when the hospice and the nursing home is to accommodate them. Investigate the viewpoint. The willingness to be dependent on others. Preferences for end of life. Past experiences with end of life. A lot of people don't want to have to depend on others for their end of life stages. People just want to go home and just go to sleep. And as far as the family, it's all about what they've already been through. If whether they had a bad experience with death or whether they had a good experience with death, and how they were treated, how the family was treated, and everything like that. Reasons for care. I mean, yes, people do want hospice because they do want to be treated with some dignity, and hospice does help with all of that to offer up at least to a year after the person has been deceased. And they do talk to them about, the burdens and the grief and what they think is best for the patient and the family. Well, what is best for the family. And a lot of families don't want to think about the end of life. A guilty feeling. A lot of family members feel like putting their patient or their loved one in the nursing home is a guilty feeling because they feel like they can't do it at home. And some people don't have the lack of knowledge that goes along with the end of life care. And then it's a lot of families that end up in denial behind how it happened or what went on with the patient or how they lived their life. And then, the patient sometimes they question their own sanity with their family involved. Summary. You have to know some things about end of life. People have mixed feelings and reasonings in the care of the different settings. And hospice is there for emotional support. And people that have regrets, sometimes they do need the social support. The end.